Hello everyone, welcome to another educational video. Today, we'll discuss the topic of managing diabetes in primary care through the lens of the Quality Outcome Framework indicators. The Quality and Outcomes Framework, QOF, is a voluntary annual reward and incentive program for all GP practices in England. It uses a point system to assess a practice's overall success in providing high-quality care across a variety of areas. We will focus on diabetes QOF indicators, and I'll explore what you can expect from a consultation with your GP. Diabetes affects people of all ages and poses a significant health challenge. It's a condition where the body struggles to regulate blood sugar levels, either due to insufficient insulin production or ineffective insulin use. When you consume food containing glucose, the body typically releases insulin to retrieve the glucose into cells or store it for later use. However, when insulin is limited, cells go without glucose, leading to glucose accumulation in the bloodstream. Over time, this can damage blood vessels and consequently vital organs like the nerves, kidneys, eyes, and heart. Now there are two main types of diabetes, type 1 and type 2. Type 1 diabetes, often diagnosed during childhood, is caused by the pancreas's inability to produce enough insulin. On the other hand, type 2 is marked by insulin resistance and a relative insulin deficiency, causing persistent high blood sugar levels. There's also a type of diabetes that can occur during pregnancy. While it typically resolves after delivery, women who experience it are at an increased risk of developing type 2 diabetes later on. Let's consider a scenario. A 55-year-old woman visited her general practitioner complaining of fatigue and weight gain. Initial tests for thyroid function, blood count, and electrolytes came back normal. However, her HbA1c, a measure of long-term blood sugar control, was at 63, and she had noticed an increase in urine frequency during follow-up visits. What are the key management strategies to discuss with her? In this video, we will use the Quality Outcome Framework indicators to emphasize relevant areas in diabetes management in primary care. Facing a diabetes diagnosis is a common and multifaceted challenge, impacting patients emotionally, metabolically, and physically. The good news is that primary care has a wealth of clinical and personnel resources to enhance outcomes for those living with diabetes or who are pre-diabetic. It is crucial to make patients aware of proven strategies, particularly the role of lifestyle changes in reducing the occurrence of complications in diabetes. In a study on diabetes prevention programs, lifestyle intervention was more effective than metformin or placebo in preventing diabetes among patients with pre-diabetes. It further explained that with a lifestyle intervention of a low-calorie and low-fat diet and moderate-intensity exercise for 150 minutes each week, patients in the lifestyle intervention group demonstrated a 67% reduction in the risk of developing type 2 diabetes mellitus. Receiving a diagnosis of diabetes can be overwhelming. Take a moment to absorb the information provided by your primary care clinician. Ask questions and work together to formulate a plan that improves your outcome. Your GP would keep a register for patients aged 17 and older diagnosed with any type of diabetes, excluding new diagnoses of diabetes during pregnancy. Managing diabetes requires monitoring and tracking several measures regularly. These include factors such as blood sugar levels, blood pressure, kidney function, cholesterol levels, and foot and eye health. By keeping a close eye on these measures, individuals with diabetes can make informed decisions about their health and take steps to improve their overall outcome. The first indicator involves the percentage of patients on the register diagnosed with nephropathy, clinical proteinuria, or microalbuminuria, currently treated with medications like angiotensin-converting enzyme inhibitors or angiotensin receptor blockers. If you notice foamy urine, puffiness around the eyes in the morning, swelling of the feet, or increased urination, inform your GP. These could be signs of excess protein in the urine, an early sign of kidney disease. Microalbuminuria, also known as biochemical proteinuria, can predict progression toward kidney failure. To detect and treat kidney disease related to diabetes, bring a urine sample to your diabetes review. Your urine albumin-creatinine ratio helps your GP measure the degree of protein in urine and determine the stage of kidney disease to enable you to take proactive steps to slow or reverse kidney disease. The next important indicator focuses on the percentage of patients with diabetes who have a documented foot examination and are categorized into 4 risk groups. 1. Low risk, characterized by normal foot sensation and palpable pulses. 2. Increased risk, indicating neuropathy or absent pulses. 3. High risk, combining neuropathy or absent pulses with deformity, skin changes in a previous ulcer. 4. Ulcerated foot. A healthcare assistant or nurse will assess your foot pulses during your annual foot check. If pulses are not palpable, they may use a Doppler scan to scan for pulses or refer you to a podiatrist for a full assessment. A sensation test with a monofilament probe at pressure points on your feet will also be conducted. Similarly, if there are concerns about numbness or abnormal sensation, a referral to a podiatrist will also be made. Subsequent annual visits allow for comparisons with previous results to monitor any changes. While your GP can prescribe medications to alleviate neuropathy symptoms, a personal foot check and optimal diabetes control address the root cause, reducing the risk of nerve damage in the feet and preventing severe complications such as amputation. Another quality care indicator involves the percentage of newly diagnosed diabetes patients who have a documented referral to a structured education program within 9 months of being added to the diabetes register. Taking an active role in managing your diabetes is essential for improvement. While receiving a diabetes diagnosis might initially seem overwhelming, you can take control of your health. Your primary care clinician will guide you to relevant educational resources to help you understand your diagnosis. Healthy Living for People with Type 2. Diabetes is a free program that provides valuable information on enhancing your outcomes. The resource is user-friendly, allowing you to test your knowledge and ensure you're on the right track. For those with type 1 diabetes, there's also the option to register for the free My Type 1 Diabetes account. This platform is designed to assist you in learning more about living with type 1 diabetes, offering additional support and resources to help you navigate your journey. Engaging in these educational programs can significantly contribute to your overall well-being and success in managing diabetes effectively. Let's look at the next quality indicator. It focuses on the percentage of diabetes patients without moderate or severe frailty, where the last blood pressure reading is 140/90 millimeters of mercury or less in a clinic, aligning with a home blood pressure monitor target of 135/85 millimeters of mercury. This particular indicator is aimed at those who are not yet moderately or severely frail. Most electronic health systems don't automatically code for frailty. Surrogate markers like the Electronic Frailty Index or Rookwood score suggest that a patient may require a formal frailty assessment to determine its severity. Your GP will combine their clinical judgment and their knowledge about your well-being to decide if you meet the criteria for a formal frailty diagnosis and then assess its severity. Regardless of when you are diagnosed with diabetes or the degree of frailty, regular blood pressure reviews are crucial to mitigating the risk of adverse cardiovascular diseases like heart attack and stroke. What other complications are associated with diabetes? Diabetes contributes to both large, macro, and small, micro, vessel diseases. Macrovascular complications involve significant issues such as myocardial infarction, heart failure, stroke, and peripheral vascular disease. While these often necessitate the use of secondary care facilities, your GP can play a crucial role in monitoring your recovery, conducting regular medication reviews, and assisting with advanced care planning. Microvascular complications, as mentioned earlier, include kidney disease, making diabetes patients 5 times more likely to end up requiring dialysis or a kidney transplant. Another microvascular concern is eye disease, particularly diabetic retinopathy, which can result in a gradual loss of vision. Routine annual eye checks in primary care help monitor for rapid changes in your vision. Depending on the degree of impairment, formal registration as visually impaired may be necessary. In the UK, this registration can have implications when seeking support, such as claiming personal independence payments. Diabetes also damages nerves, leading to foot problems, sensations like pins and needles, bowel and bladder dysfunction, and fluctuating blood pressure. It is helpful to know that kidney failure and vision loss occur far less than cardiovascular outcomes. Maintaining good glycemic control is key in slowing down the progression of these complications. It is also important to be aware of additional complications, including anxiety and depression, infections, and a general decline in the quality of life. During consultations, be supportive and empathetic to your patient. Explore the patient's ideas, concerns, and expectations, offering relevant support to address both the physical and emotional aspects of living with diabetes. Regular communication with your primary care team and an integrated approach to care would contribute significantly to a patient's overall engagement. The final 4 Quality Outcome Framework (QOF) indicators focus on setting target HbA1c levels based on the degree of frailty and the use of statins, details of which are outlined in the accompanying chart. Moderate to severe frailty and high blood pressure can make it challenging for individuals to manage diabetes. Frailty is a condition that comes with age and causes a decline in physical health, making people more vulnerable to negative health outcomes. Diabetes can worsen health outcomes, particularly increasing the risk of cardiovascular diseases. Your general practitioner will determine the target HbA1c based on your level of frailty. Although there is a chart with appropriate targets, it is important to note that each person should have a personalized assessment. In terms of cardiovascular risk assessment, while the Q-Risk score is a valuable tool for assessing the risk of cardiovascular disease, it does not consider how long a patient has had diabetes or whether complications are already present. We know that the first 5 years are critical to addressing diabetes when the risk of cardiovascular outcomes is lowest. As illustrated in the chart, the risk of coronary heart disease increases with the duration of diabetes. Your GP can use the Q-Risk tool for risk stratification, but may offer additional advice based on how long you have had diabetes and whether statins can help reduce the risk. For a more in-depth understanding of cardiovascular disease risk assessment, check out our video on cardiovascular risk management in primary care. In conclusion, diabetes carries significant implications for both you and your loved ones. Remember, there's no need to despair. Seek help and support from your primary care team. In this video, we have covered the Quality Outcome Framework indicators for diabetes management. Thank you for watching, and don't forget to like, share, and subscribe to the channel for more education.